Studies have shown that people living with HIV have a higher chance of developing mood and anxiety, among others. It is important to remember that mental disorders are treatable, and people who have a mental disorder can recover. Speaking during Media Science Cafe meeting in Lusaka on how mental health impacts the update of ARVs, Ministry of Health HIV prevention lead Dr. Chimila Phiri has disclosed that in Zambia various studies have been done, and it reveals that about 40% people living with HIV suffer from depression and begin to isolate themselves, which is not healthy. Dr. Phiri further called on health personnel to uphold their professional ethics by keeping their patients' medical reports a secret.
These stresses and the fear of being diagnosed with HIV, people tend to shun away from accessing HIV sepsis. Remember I mentioned that the first entry point is testing. We cannot guess. Okay, even when you come to me, Dr. Phiri, I want some services, whether it's treatment or prevention for HIV. Yes, I'd be glad to offer those services, but first of all, I need to establish your HIV status. How do I do that? Testing. Okay? Alright, so there are a number of disorders that could affect the mental. By the way, the mental health is actually a basic human right. Right? That we must appreciate. But it's a basic human right. And as such, everyone has to enjoy mental health in terms of well-being, right?
Treatment advocates and literacy campaign representative Kanyima Banda notes the need for urgency in addressing stigma, stating that this is to enhance the well-being of all the people living with HIV.
And also that because of stigma, certain things or stigma has affected them in one way or the other. So self-confidence has been affected. This was quite high. Most of them reported that their self-confidence has been affected. Their self-respect is also affected. Even the ability to respect others is affected as well. Some has ability to maintain close relations. Even the desire to have children. So we see that stigma affects people in so many ways. And because of that, some of them have avoided to even go to the hospitals. Some of them have avoided to apply for.
Makanika Tongo is a counselor.
But sometimes mental health is challenged, and it changes the way we adapt and view life. Okay. And as these changes come and these challenges come, we all adopt ways of coping. But sometimes we end up with mental health conditions like depression, like he has elaborated, anxiety, stress, suicidal ideation, and other mental health issues. So HIV affects us all because, like they say, if you're not infected, you're affected, right? So a positive diagnosis may come with different emotions.
Malangi Nzombola reporting.